My first mammogram was when I was 40 years old.
40 was the recommended age for women to get their first routine mammogram until today. The U.S. Preventive Services Task Force changed its guidelines to say women in their 40s should talk about the risks and benefits of getting screened with their doctor and schedule a mammogram at age 50.
It's so frustrating that that they want to change the law from 40 to 50 years old. If I had to wait until I was 50, I would not still be here.
Sandifer is not the only survivor who's outraged by the new guidelines.
I went for my first mammogram when I was 39 and I was diagnosed at 40. I had a highly aggressive cancer. So if I had to wait another 10 years, I would have been dead.
If they hadn't found it, I would probably be dead.
One doctor I spoke to said it's key to find the cancer early and that waiting could mean life or death.
2 years to get the workup and everything, that's too late for her. We're jeopardizing patient lives like this.
The task force says data shows many women who get mammograms in their 40s experience false positives. This can lead to anxiety and unnecessary biopsies. But some patients and doctors think insurance companies are pushing for these changes.
It sounds like this may be coming from the insurance companies, and I think it's a crime.
Female below 50, the insurance will not cover them.
Dr. Al-Jazari says guidelines are not black and white and every patient would be examined carefully. But he says some physicians would be reluctant to order mammograms early under the new guidelines.
The money should not be an issue. It's a health issue. It's a people issue.
There's somebody's mother that needs to be around long enough to take care of their children and that desire to see their grandchildren.
The U.S. Preventive Services Task Force did not return our phone calls. The task force website says screenings before 50 years old should be a case-by-case decision between a patient and her doctor. Rachel Thomas, Annenberg TV News.